Throughout this year, GMK anchor Eric King has been putting the spotlight on Black men in healthcare and the importance of prevention and early screenings, even sharing his own personal health story. An hour-long deep dive into the topic is now streaming on WHAS 11+. It's called The Color of Health, and Eric joins us this morning to talk about this really important topic. And well, it's always good to have you on, by the way.
Well, I just love
you love when I'm done with the place. Well, I love what you've done with this topic, right? And it started as something that has happened personally in your family growing up. You're seeing a pattern of something and you're like, wait a minute, we've got to talk about this.
Yeah, I make a passing joke, appropriate or not, about growing up and being in church. And a small church in Fairfield, Kentucky. And I remember there was always the sick and shut-in list. And you would see people on there, and I would dismiss it because I was a child. And I thought, oh, these are old people. But now I look at it and I see diabetes, I see kidney disease, I see hypertension, I see stroke, I see things that are preventable. And then you start looking through my own family and you see the amount, particularly of Black men, that have died from illnesses that were on some level preventable had they just gone to primary care doctors regularly. And these are men that were fully insured.
Yeah.
You know, we all know that there are barriers to healthcare. We all know it's expensive. We know that we could be better in that. But the reality is these were people that had full access to healthcare and chose, for whatever reasons.
But I've loved with the series of stories that you've presented, it's been you talking to doctors about your health, you talking about your family, and presenting those barriers. And then at the end of that, the response had to be so great that you're all like, we need to put this in an hour-long special together, you know, and present it. I think sometimes, though, don't you think, too, that when you put something together in an hour and you present it as something, that it does draw people's attention more?
I think so, and we did this deliberately because, full disclosure, this wasn't supposed to be an hour. I think it was supposed to be about 30 minutes. But as we started working through it, we wanted to do something deliberate at the end of it. We wanted to do a round table conversation, which is partly what you're seeing right now, because one of the troubles that people have going to see doctors is they feel as though there's a disconnection. They feel like the doctors are mechanical. They feel like the doctors might not care. And there's a lack of trust, particularly in the Black community. We know of studies over the course of history where Black people were used as guinea pigs. You know, that's real. That's true history. And so I wanted to present some people from the medical field in an environment where you can see them. You see you see her laughing and just being personable. I wanted people to see them in that environment so they realize there is no barrier between us and these physicians. These physicians want to be able to go home at night and say, I helped Claudia, I helped Eric. It's not a business to them. It really is a calling. And I think if you present people in that way, hopefully that tears down some of those barriers.
I think the title of it, right? How appropriate, The Color of Health.
Yeah, our producer, my producer, Lena, came up with that. And she was right on the money with it, because people would say to me, you ask about the response to this. Well, some of the response has been, well, Eric, white people have high blood pressure too. White people have kidney disease. And of course that's true. But what we dive into is why there are differences ethnically in the outcomes of these diseases. I'm going to turn 45 in 3 weeks. I am 3 times more likely to have a stroke than anybody else in here. I'm the only Black man in here. 3 times more likely at the age of 45. That's specifically because of our rates of high blood pressure, which are extremely higher earlier in age. And so, yes, of course, all ethnicities struggle with these ailments, but the outcomes are vastly different for African American men.
You know, we see the partnership that you've had with Norton Healthcare.
They've been great.
Right? Like, that's what I wanted to ask you about, because so often I think as journalists, we pitch an idea, and here's my story idea, and here's what I want to bring attention to, and you feel like you are in a silo, you know, saying let's bring some important to this, but to have, I mean, talk about like the importance of having a Norton Healthcare along to not only partner with you on it, but haven't they also like put together like e-blasts and different bits of information based on what you've talked about?
They have put out some of my material in their newsletters, and I was working with Norton initially, obviously the highest level of respect for them, but my personal physician is a Norton physician, and I knew that I needed to have him on board with the story. And so once I went through the appropriate channels with Norton Healthcare, they said, oh, well, we can help you with this and we can help you with that. And it turned into this, whatever you need, Eric.
Oh, wow.
And it really opened the door for us to get access to patients, to get access to physicians and practitioners in a way that was candid and honest and forthcoming and real. You know what it's like to interview physicians sometimes. It can be very difficult.
And I don't even know what they're saying.
Right. It can be
At
very
all.
difficult. But we really tried to make this digestible. And what scares me more than anything is there's nothing sexy about this story. There's nothing flashy about it. But the information in it is critical.
Yeah.
And what scares me most is to think that people will not watch it because it lacks that flash. When the reality is, it could very well be the most important thing that you see.
Absolutely. So what has your family said about it?
My
Always
family's
love hearing
very
it.
happy.
Yeah.
And you know, the thing is, I was scared to do this story because
Really?
you almost have to put some level of blame on people who have died, right? You have to look at your grandfather.
I didn't think of it that way.
You have to look at your grandfather who died of cancer when, you know, he hadn't gone to the doctor. By the time that he found out that he had cancer, it was stage 4 and he had months to live, right? And so how do you tell that story publicly in a way to educate others without pointing the finger at what you
Look
did
what
wrong?
my family did.
And that was the struggle that I had.
Yeah. Have you now done anything differently or approach things differently as you approach your birthday and think about, okay, this runs in the family? I mean, is there something different with the way that you now approach your health?
I am getting my colonoscopy on day 1 of turning 45
yeah.
because I recognize that that's a mile marker. I monitor my own blood pressure at home regularly with, you know, a piece of equipment that I got at Walgreens.
Yeah.
You know, I'm on top
See,
of
it's
things.
the simple things like that that you could do, right? It's not always a trip to you could start doing things at home too.
Blood pressure is the thing too, Claudia. The most important thing that you can do right now, if you have not visited your healthcare practitioner in a long time, is check your blood pressure, because if that's something that we can get a grip on, everything else on some level almost goes away.
Thank you so much, my friend, for stopping by. Really
Anytime.
important topic. You know what? You can watch Eric's special, The Color of Health, streaming now on WHS 11 Plus on Roku and Amazon Fire.